How would you sort of summarize that in your elevator speech to them about the benefit of melatonin potentially in which patients and how it should be used if it is going to be used? And um, how would you sort of summarize that? Because it depends, right, on the data that you're looking at and what regimen is used. So how can we help patients come to a bottom line on that? It's
Yeah,
difficult.
that's a really great question on like how do we put it all together?
Yeah,
So think
yeah.
about like a parent that's concerned that their child isn't sleeping well, and so they enter a pharmacy or they're within a hospital system, and they're talking about some of the challenges that they're having at home, and the question comes up of pharmacist, what can you tell me? What do you recommend
Hmm.
for a dose, and how can I best use this in my child? And we want to really think of one key thing before we just blurt out a dose, right? As pharmacists, we take pride in our knowledge of, oh, I know this dose. So let me tell you, I
All
can.
right, right,
But
right.
oftentimes we have to think about, wait a minute, what are we using this for? And is it really
Right.
actually the appropriate thing to do in a case by case scenario? So again, often when the parents are asking about melatonin, it's because their kids are having a hard time sleeping and they're really grasping at straws of like, what is it
Hmm.
that I can do? And sometimes they
Hmm.
don't even realize some of the environmental factors are actually the problems that are
Right.
preventing their children from sleeping. So we really want to be able to identify what are those underlying behaviors? What does that sleep environment look like? Rather than thinking that it's maybe a physiologic problem, which is commonly the reason that we should be using melatonin.